Hello friends, I'm Himanshu Sharma welcoming you to today's launch event. This day marks a paradigm shift in knee replacement surgery space. Einstein once said that we cannot bring solution to problems with the same thinking as they were created. It is very relevant even today. When it comes to healthcare and hospitals, it is even more apt. When you visit a hospital or a doctor, we visit with a lot of expectation and hope. Expectation for the doctor to help us get a proper diagnosis, expectation to get treatment, and expectation to be cured from the disease. Well, this has carried on, but in the current times, this expectation has been added with a small word, which is quickly. Yes, friends. When we visit the hospital or the doctor today, we want a quick appointment, we want a quick diagnosis of our problem, we want quick treatment, whether it's surgical or it's medical, and foremost, we want a quick recovery. We want to get back to our routine life ASAP. Keeping this in mind and its patient centricity values in mind, Zydus Hospitals decided to come out with a path-breaking program. A program which is designed around its patients' requirements. A program that made us walk a different road. The road was tough and it had a lot of challenges, but we carried on with that. And as we carried on, today we stand with a great, phenomenal surprise for all of you. One-day knee replacement. Yes, friends, exactly what you heard is right. One-day knee replacement. We are able to discharge our patients safely within 24 hours of surgery. And this has been made possible by deep management understanding and a cohesive approach by the team of Zydus Hospitals. And I would now like to invite the team which is responsible for making this happen, Dr. DARIA SINGH and Dr. Kalpesh Patel, over on the stage for a brief discussion. Please come over. Dr. DARIA, have a seat. Dr. Kalpesh, have a seat.
Thank you.
So this new innovation of yours, we are gathered today to discuss that. Dr. DARIA, this new concept of one-day knee replacement, which we have discussed for the launch we are planning today, I would just like to understand from you, it's a very exciting thing for the patients, it's a very exciting thing for their families, those who do not want to spend much time in the hospital. What is the idea that you had at the back of the mind before we got this from the drawing board to the operation table?
In fact, this world is changing very fast in terms of social and in economic terms. And in this changing scenario, patients' perspective and patients' expectations are changing. Patients want a very quick recovery after any surgery, especially after knee replacement surgery. They want acceptable range of movement, they want functional ambulation, and they want restoration of their pre-arthritic status as soon as possible after surgery. They want to go home early. They want to resume their work or their duties very early. And they also expect hospitals and their doctors to use advanced technique so that their outcome can be guaranteed. And while traveling this journey, they want maximum comfort, or you can say minimal discomfort. They also want to travel this journey with minimum risk, or you can say maximum safety. They also want that this recovery should be in homely or friendly environment, especially in this current COVID-19 pandemic.
So it's the COVID-19 pandemic which motivated you to think through the whole process and get this concept converted into a program which is available to all the patients, right?
Yes. So being patient-centric hospital, at Zydus, we are committed to provide best available treatment all the times, matching to the global standards in terms of both technology and outcome.
Right, makes a lot of sense. So basically the patients are the driving force behind this whole exercise, if I understand correctly.
So we also believe in philosophy of Kaizen. That means continuous improvement. after doing it better, we have started doing it quicker, thus improving all aspect of perioperative hospital stay, thereby addressing all parts of recovery.
That's very encouraging. So driving the quality, not just better, but from better to quicker is a huge transition for the patients.
Yes.
They don't need to spend much time in the hospital. They are ready to go home early, and obviously, I mean, a hospital, even if it's a 5-star hospital, is a hospital end of the day.
And yes, I can assure you this one-day knee replacement surgery is evidence-based clinical care.
Okay.
With organizational optimization, including revisions of traditions.
Right. So it's a whole link of the system which has existed, but it has been retuned to make sure that the patient is able to leave the hospital the next day.
Yes, that resulted into a streamlined pathway from admission to discharge.
Wow.
And beyond that also.
That's very interesting. That's very interesting.
So this is how we have developed this one-day knee replacement program.
Okay, so the concept looks very encouraging, and I'm sure many patients would be, they've already been benefited, and there will be many patients in future who would be taking advantage of this. Dr. Kalpesh, I would like to understand from you, working together with Dr. DARIA Singh on this program, how the background of this, like on the foreground you have the patient coming for consultations, and you are explaining them that this is how you're going to go ahead and do the procedure. But in the background there must be a lot of things which will be happening to make sure that everything goes well. If you can just give us a brief upon how you manage the show on that aspect.
Yes, Himanshu, right? It is not that simple as it looks.
Absolutely.
Because our program, One Day Knee Replacement, is goal-based, patient-focused program, which takes care of every aspect of perioperative hospital care of patient. So journey of your pain-free knee starts from patient education itself. We educate the patient regarding its disease, possible treatment, benefit of treatment in the future plan. We believe that a properly educated and well-informed patient is a good patient. The next important aspect is preoperative optimization of the patient. For that, we investigate patient thoroughly before operation. We take help of our team of physicians. They evaluate the patient, take detailed history, and if need arises, they change the treatment before the surgery to optimize the patient for the surgical anesthesia and post-operative period. Our team of physical therapists also involved in this unique approach.
Okay,
they evaluate the patient before surgery. They make a tailor-made physical therapy program. So our physical therapy program not only start after surgery, but also before hospitalization. So the patient is well acclimatized with the physiotherapy that he or she has to do after surgery. The next important aspect that I would like to emphasize is a proper and precise surgical technique. With the help of precise surgical technique, we are able to achieve a proper limb and ligament balancing, which in turn help us to achieve the mobilization goal of the patient after surgery quicker. Along with that, proper surgical technique help us to manage blood loss by reducing the muscle and soft tissue violation. In the post-operative period, that comes the role of excellent nursing team. When patient is shifted to the ward after surgery, periodic evaluation is done by our excellent nursing team. As early as the effect of anesthesia has been off, we start mobilizing the patient. We, along with our physiotherapy team, mobilize the patient out of the bed. So it is not only to build the strength of the muscle, but it is also to avoid any complication related to long-term bed immobility, like bed sore, deep vein thrombosis, and pulmonary embolism. So now if I think of discharging the patient, for that we have made an exhaustive list of discharge criteria.
Okay.
That all discharge criteria must be fulfilled by the patient before we mark the patient as safe for discharge. So this is the whole background which we have worked upon to make our program safe and smooth.
So it is very intriguing, friends, that we have a systematic approach to every aspect of the patient care, not just when we plan the admission, but it starts much before admission, when the patient is visiting in the OPD.
So it is not only we and the patient, It is we, physiotherapy team, our physicians team, anesthetist team, our nursing staff, and as well our administrative staff, starting from the admission days to the discharge process.
Right, so it is like a well-oiled mechanism which has to work perfectly in order to make sure that we achieve the one-day discharge criteria for the patients.
Synchronized approach.
Yes, absolutely. Synchronized, well-oiled, well-orchestrated approach to make sure that a patient goes home as early as 24 hours. Dr. DARIA, it's interesting to learn about how meticulously the planning goes in for each patient before they are operated, much before they are operated. I would like to understand the question, which is actually a matter of concern to me as an individual as well. That how do you efficiently manage pain? Because it's a matter of just one day that a patient is in the hospital and you're sending them back home. But pain is probably not going to go away. So if you can just briefly explain us, how do you manage that part?
So pain relief is most important part of any surgery. So it is after knee replacement surgery.
Right.
And we ensure each and every patient must have minimal post-operative pain before discharge. And if one defines this pain on a scale of 0 to 10, visual analog pain score, then this pain score must be 2 or less than 2 before discharge. And for that, we deploy a multi-modal approach starting from pre-operative period to achieve our goal quickly. And this pain management approach depends upon 4 major verticals.
Okay.
Number 1, patient education. Patient education reduces the anxiety of surgery. It also reduces the anxiety of recovery from surgery. It also addresses uncertainties about recovery from surgery. And reduced anxiety and uncertainties leads to less post-operative pain, thereby requiring minimum pain medicines. So precise surgery and soft tissue trauma, minimal soft tissue trauma, plays a significant role in reducing post-operative pain.
Right.
And we ensure a high level of accuracy and minimal soft tissue trauma during surgery through our precise planning and execution of surgery, thereby minimizing post-operative pain. And that can be managed by routine pain medicines.
Okay, that's very encouraging for our patients who are looking for options for knee replacement, that you are coming to a place where you are educated about managing pain much before you are on the operation theater table. So that gives a lot of confidence, and that gives a lot of comfort level as well to the patient.
Yes. So then we use various class of medicines to address pain, address post-operative pain. And we start using these pain medicines before surgery, a night before surgery. A night before surgery, we give a pain relieving medicine, a medicine which modifies the pain, and a medicine which reduces the anxiety. So we addresses 3 components of pain.
Okay.
A actual pain reliever, a pain modifier,
And a pacifier.
and medicine which reduces the anxiety. And intraoperative and postoperative also, we use different class of medicines through different routes of administration, like intravenous pain relieving medicine, oral pain medicines, pain medicines through transdermal patches, and various nerve blocks. In this period, we also use pain modifier medicines.
Okay, so it's basically a composition of different pain management modalities
Yes.
that you deploy so that a patient is ready to go back home within 24 hours of the surgery.
Yes.
And stays well at home, does not have to come back to you.
Yes. Last but not least, we also utilize physical modalities like cold therapy.
Right, they're very important.
All these various approaches, we are able to reduce pain. If you measure this pain on a visual analog pain score, then less than 2 or 2 within 24 hours.
Wow, that's an absolute achievement.
This is one of the most important discharge criteria in our one-day knee replacement program.
Right, definitely. I mean, a patient is coming to you because they have pain.
Yes.
And they would definitely not leave unless they are
Right.
pain improved. I'm
Yes.
not using the word
So-
completely pain relieved because
so
that takes time. While we've been discussing all about one-day knee replacement surgery, I would like to understand, how do you ensure your patient's safety during and after the knee replacement surgery?
Safety is our main concern. Our whole focus is to ensure safety of our patients. We aim that no patient should require any hospital readmission after discharge. We also aim that no patient should develop any adverse health event post-surgery. We have made certain discharge criteria to ensure safety of our patients.
Okay.
And these discharge criteria are based on vital parameters, pain, blood loss, local knee examination, ability to perform daily activities of life, social and logistical support, and last but not the least, patient's willingness and confidence
Right.
that they can go home and they can no longer require hospital stay or hospital care. So once patient meet these discharge criteria, we discharge them home.
Dr. Kalpesh, my next question to you. How frequently does a patient need to visit your OPD for a follow-up, and any specific investigations that they need to come prepared with prior to coming over for a follow-up visit?
So if we talk about post-discharge follow-up visits, so there are very few. Rather than asking patient to physically present in the hospital, what we are doing is taking advantage of our in-house teleconsultation services.
Okay.
With help of that service, we are making video consultation with the patient daily. We ask them about their difficulties, their pain level, their mobility, ease of doing physiotherapy at home, or any other queries that patient want to ask us, and we solve it. Along with that, we are providing a post-discharge sit to the patient. They regularly monitor the vital, they enter it and they send it on WhatsApp. So we'll review it and do necessary changes that requires. Physical presence of patient in the OPD, that we usually ask after say about a week. At that time we check wound, we do a proper wound care, we check for the movements, strength, and according to patient's progress we do the necessary changes. So by doing this, the level of healthcare which is provided into the hospital, we are trying to provide it at home. For that we have also formed a home healthcare team.
So what's interesting, friends, is with one-day knee replacement, you are not just getting a knee replacement, but a total care promise. That even when you are at home, you have been monitored by the same professionals who operated you, and it's an end-to-end total knee replacement solution. Dr. DARIA, we have learned a lot about your one-day knee replacement program. The people, those who are seeking knee replacement, any message that you have for them, and a message for also those who can avoid knee replacement in future.
So prevention is better than cure. This applies to health of joints as well. So I would suggest our viewers that they should take care of health of their joints to avoid damage to the joint. In case they have already hurt their joints, then early intervention can prevent permanent impairment. In case advanced arthritis, joint replacement is safe and effective alternative to pain and suffering, that too with a reduced hospitalization.
Right, so our viewers have a fantastic take-home message. If you have joint problems, firstly, then there is a solution. You don't need to worry. There are ways in which you can reduce the possibility of your joints getting damaged, and in case you have initial damage to your joints, you must visit your doctor. Delaying the visit to the doctor is not going to heal you. Our facilities and our services are available for one-day knee replacement for all our viewers, and we help to reach and help as many people as we can. With this, I would like to thank both of you for giving us such informative thoughts about one-day knee replacement. I'm pretty hopeful that this will benefit a lot of people. Thank you very much.
Thank you.
Friends, we had a very learning experience with our joint replacement team pertinent to one-day knee replacement. Now, I would like to invite virtually our chief guest, Padma Shri Honorable Dr. Pankaj Shah, who's going to share his views and his insights on one-day knee replacement.
Thank you, Himanshu, for involving me for the initiation of a new services at our Zydus multi-speciality hospital. I am proud to say that under the leadership of our orthopedic surgeon or the joint replacement surgeon, Dr. DARIA SINGH, we have performed more than 1500 joint replacement surgery. Now, according to pilot study done by DARIA SINGH and his team, they are coming up with, at present, getting more and more popular the new technique or the new system that is known as outpatient joint replacement surgery or a daycare joint replacement surgery. Dr. DARIA SINGH has studied this particular pilot project in a big way and found that to reduce the complication, to reduce the hospital stay, and to give a better functional care to the patient, this is probably going to be a game changer in the treatment of the joint replacement therapy. Only thing is that there should be judicial selection of a patient, and that he is going to get the best protocol in the world which decide which patient is good for this type of surgery or not. And for this, he can select the young people, he can drop the patient with lots of medical complications like diabetes, patient on anticoagulant, hypertension, or on a patient on aspirin, etc. Or the smoker, an obese person with a high BMI. Apart from that, around another 30 to 40% of the patient in this group of osteoarthritis requiring the knee replacement or hip replacement, this type of one-day surgery or outpatient surgery is possible to my friend Dr. DARIA SINGH. And the complication rate for a shorter stay surgery is going to be much less, particularly wound infection, bleeding, etc. However, one should understand that the joint replacement surgery is not only the surgical art, it is a teamwork, pain control by anesthetist, a good anesthetist and the pain control, and the rehabilitation team under the good physiotherapist. So DARIA SINGH has made a team of these people. After care, before care, any patient who is going to taken up for this surgery, he will find first 10 to 15 or half an hour to explain the patient the procedure and the advantages. I am happy to share with you that the 1500, the conventional treatment he has done at Zydus, the readmission rate is almost zero. So this is what the quality of care our Department of Joint Replacement is offering. And while going for this daycare surgery, which he has done in more than 10 patients so far, whatever is done outside the world, it is according to that only. Friends, in India, more than 1 lakh knee surgery and more than 70,000 hip surgeries done. And if only 20% of this surgery are now converted into a daycare, how many hospital days will be saved? And that is a nation saving in the cost of the hospital care. Another important aspect is that this is the COVID time. For last 8 months we are fighting against COVID. Nobody will like to stay in a hospital for a longer time. A one-day hospital stay will make patient more confident that he is not going to get exposed for a longer time in a hospital environment and having danger of COVID. So such procedure, under the leadership of a very competent orthopedic surgeon like Dr. DARIA SINGH and his team and anesthetist and the physiotherapist, I think so this is a new direction in the care of the knee in our country and in our Zydus center. I wonder that I had my knee surgery 10 years back, only one knee. And whenever I meet DARIA SINGH, he looked at my leg, another leg, and was asking for that knee joint, and I was avoiding it because I am not having much pain but more limp. When I listened and when I read about the new technique, I thought that if I am born 10 years earlier, I might have gone for this particular procedure. I wish Dr. DARIA Singh and his team at Zydus all the best and more such surgery for the competent people, young people whose quality of life will improve. They are executives. They have after 60 or after 55, they have more 20 years to go because the life of the implant is more than 20 years nowadays because the good quality of implants are available. All the best, our joint replacement department and the daycare surgery at Zydus. Thank you.
And now I would like to invite our very pivotal physiotherapy team for a short discussion regarding how they manage our patients pre and post discharge from the hospital. Please come, have a seat. So it's nice to have you both. We've had a learning session with Dr. DARIA Singh and Dr. Kalpesh Patel regarding one-day knee replacement. Obviously, you guys both are a vital part of the whole program, being physiotherapists which are dedicated to this program. So Dr. Shastri, I would like to start from you. You have been instrumental from the physiotherapy perspective for one-day knee replacement. I would like you to explain to our viewers how exactly and what exactly do you do to make sure that your patients are prepared for the surgery?
Prehabilitation, which means exercise program prior to surgery, is a key component for faster recovery and meeting discharge criteria in 24 hours. When patient decides for surgery, we evaluate patient in detail. That includes pain, range of motion, muscle strength and gait. As per our evaluation, we design a tailor-made exercise program for each and every patient and we ask them to follow it prior to surgery. There are scientific data available which suggests that exercise program prior to surgery can reduce overall length of stay in hospital, that decreases post-operative pain and stiffness, that improves range of motion, that improves strength of muscles which are weakened by long-standing pain and disease process, and that also improves overall functional outcome.
Oh, so that's very interesting. So there is a new term that we have learned today, our friends, that it's prehabilitation. So much before the patient goes in for the surgery, there is a prehabilitation process that starts whereby your physiotherapist guides you and exactly tells you, which is a customized thing, told to you which exercise to be done, how much to be done in order to strengthen your muscles. Thank you, Dr. Shastri, for this information. It's going to be extremely helpful for our viewers. Now I would like to come to you, Dr. Poonam.
Yeah.
Discharging a patient in one day, it's a challenge, right?
Yeah, exactly.
And how do you manage them when they are home? Because you are taking care of that part. So how do you manage them? If you can just quickly tell us about.
Yeah, indeed it is very important and challenging for us. But before discharge, make ourselves very sure that patient and their relative must have knowledge and importance of all exercises.
Okay.
Apart from that, we teach them each and every exercises. We make a patient walk and also teach them how to use chairs. We give them exercise leaflet with the do's and don'ts after a surgery.
So in one day you are making them walk,
Yeah, exactly.
stair climb,
Yes, patient and yes.
and they are willing to do that.
Yeah, and they can do that.
Oh,
And they are
wow.
really very happy with the results.
Okay, that's
Yes.
very, very encouraging for us.
Yes, and even after discharge, we keep them in a loop through the telemedications.
Okay.
Yes, and because of that, we can solve them queries.
So what you told us is really an eye-opening and something which is very important everybody should know about. I would now like to ask you something, Dr. Poonam, as you are taking care of the post-discharge physiotherapy of the patient. So I would like to understand from you, how exactly do you ensure that your patients are happy with physiotherapy? Because it's understood that physiotherapy is painful. So how do you manage them prior to discharge and post-discharge?
Yeah, indeed it is very important and challenging for us. But before discharge, we teach them exercises, we make them walk, we even teach them how to use chairs. Even we teach their relatives also how to do everything at home. So all these things make it is possible, And along with that, at the time of discharge, we give leaflets of exercises, do's and don'ts after surgery also. And with the help of telemedicine, we are able to monitor the progress of exercises at home, and we keep them in loop for the further rehab and everything. That makes possible for us.
Wow, so viewers, it's really amazing that we have the prehab and we have the rehab linked together, connected through telemedicine. So the patients who are seeking one-day knee replacement are connected to their doctors, are connected to their physiotherapist, so the whole loop stays complete with any kind of a support they may require. So that's the beauty, that we are not just discharging you from the hospital, we stay connected to you even post-discharge. So Dr. Shastri, your information has been really vital, and I'm sure it's going to help our viewers. So thank you very much for giving us enlightening information on prehab and rehab. It's something which we've not heard of earlier. So thank you very much, and I'm grateful that you were able to join us today for this session. Thank you. Thank you very much for joining us. So friends, there is a lot we have learned today. A lot of things about one-day knee replacement surgery, how it is going to transform the knee replacement space at a national level and globally. So please do take advantage of this program. Reach us in case you need any information or assistance. Thank you.